Yeah. And look, and people get confused around the label behavioral optometry and behavioral vision care. And I had a teacher say that the way I explain it to the parents is that it's we look at visual behaviors, and we look at how vision fits in with what you're trying to do. Vision is what guides your movement, and it's
Mm,
your master sense when it comes to sort of learning. So
mm,
we have a look at how someone moves their eyes, how they focus, how the two eyes work together. And importantly, can they do those things easily without having to concentrate on it? Because if you're having to concentrate to keep the two eyes working together and keep things focused, that's concentration you don't have for learning. And if we catch a vision problem in the early stages of eye strain, then sometimes I like to call, we might prescribe the ergonomic chair for the eyes. So if we have a look at ergonomics as an industry about making us more comfortable when we're in an office environment, well, why is that? Well, again, we're sitting still. We're not designed to sit still forever. So
mm,
we have to sort of create desks and chairs and keyboards and mouse and screens. I've got a curved screen here, which is meant to be better for ergonomics. And it's a way of helping our bodies be in a more comfortable position. And I don't think the visual system is any different. And so sometimes we can use very mild lenses to help with kind of like a visual ergonomics to take the strain away, digital eye
mm,
strain, even just eye strain from reading. Um, to take it further, though, if someone never developed the good enough skills to begin with to be able to manage the pressure and the demands, the visual demands of modern schooling and classrooms and learning, or it deteriorated because of that strain and we just didn't pick it up early enough,
mm,
then we can use vision therapy to retrain those skills. Vision is something that we're obviously born with the potential, but we need a lifetime of learning and development to learn how to use it. It's a
mm,
bit like learning how to use your arms and your legs and your hands and your mouth. We need to learn how to use our eyes. And so, if it's something that can be developed as a skill, it's something that can be retrained and helped developed in a very programmed, systematic way to either rebuild skills or provide skills that didn't quite get there to begin with.
mm. So I know there are like some computer-based, training apps. I think that can help to a certain extent. I've seen people talk about pencil push-ups. I think that's like I know what a pencil is. I'm less familiar with push-ups,
Yeah.
but it's like that kind of thing. But there are probably other types of training programs, therapy programs that your practice does. Can you
Yeah, look,
talk a
there
bit
was
about those?
a pretty solid bit of research done over a good 10 to 15 year period that really showed that those basic kind of activities might be well meaning, but they're not very successful in providing the sort of change and symptom relief that people need. They're just too simple.
Mm,
It's a bit like seeing someone with a limp and saying, please stop limping, without removing why they limped, or really showing them how to walk straight again. And so those simple kind of activities really aren't that effective. And so we tend to use what we call an office or clinic based vision therapy approach, where it's like personal coaching for the visual system. You're working one on one with a vision therapist to really understand how your vision currently works, understand a way of developing better skills, and then having someone coach you through the process of making those new skills a habit so that you own them. And then when we're done, that you hang on to them, and they just work in the background. So you've now got a visual system that's working without you having to think about it. And so it's a very hands-on approach at developing visual skill.
mm. And so, in the case of children, like parents obviously play an essential role in that whole training treatment program.
Absolutely. So, obviously we're training the parents in order to, it's a journey to understand how vision impacts on their child's ability to learn and study, and maybe even affects their coordination and ability to participate in sport. But the reality is that some we do need some practice to make it stick. And so, the parents are involved in delivering the therapy at home with guidance from our vision therapists on a weekly basis.